The shocking death of actor Chadwick Boseman on Friday from colon cancer has brought renewed public attention to what is the third most common type of cancer in the U.S. Boseman was famous for playing iconic roles like Jackie Robinson, Thurgood Marshall, and the role that catapulted him to international fame, the Black Panther. He was diagnosed with colon cancer 4 years ago, but kept it private. To talk about the disease that cut the actor's life short, I want to bring in Dr. Andrea Cercek. Dr. Cercek is a medical oncologist and director of the Center for Young Onset Colorectal Cancer at Memorial Sloan Kettering. Doctor, thank you so much for being with us. So, Chadwick Boseman was 39 years old when he was diagnosed. How common is colon cancer in someone that young?
It's uncommon, however, the rates are rising. And that's really the scariest part about this, is that colorectal cancer is typically a disease of patients in their 60s or 70s. And what we're seeing, and what we've been seeing really since the mid-1990s, is that there has been a steady rise in patients younger than 50. And in fact, the fastest rise is in patients ages 20 to 30.
Is there any indication what is causing that rise?
So we really don't know. There is a large research effort into finding out this reason, because it doesn't seem to be linked to typical risk factors like obesity, dietary changes, more of a fatty Western type diet. Many young onset patients, really, when we look at our data, as well as national data, are fit, are not obese, and so really don't match that typical risk factor profile. So the question is it something that has changed in our environment over the last several decades? Are we eating something differently? What is really happening to our colon lining, to our mucosa, that's causing these cancers to form so much earlier than they used to?
That is very scary news. Now, the American Cancer Society recommends the average person begin regular screenings for colon cancer at age 45. Considering what you just said, is there the possibility that that recommendation may be lowered?
I think that's something that's discussed a lot. And certainly, when you meet patients that are in their 20s or 30s and have essentially no symptoms or no family history, it's difficult to say, well, or we want to say, well, we should just lower it. But the problem is that we can't screen everyone at that age, because it is just too many people to screen for the number of patients that are affected with colon cancer. So the real bottom line is that we have to figure out who is this group at risk. What is it about them? We don't think it's genetics. Is there something else, some other risk factor that we can identify, and then extend screening to that group at an earlier age?
Now, African Americans do have higher mortality rates from colon cancer. Is that correct? Even after adjusting for comorbidities? So what accounts for that? And is this part of the screening, is this taken into consideration when you talk about screening recommendations?
So for African Americans, because we know, and we've known data have shown that they have higher incidence as well as higher mortality for colorectal cancer, some task forces have recommended screening at age 45, actually longer than this new general recommendation for the general public from the American Cancer Society. Why that is, though, we really don't know. We don't know if they have a different biology, if they have some predisposing factors that we have not yet identified, or if it's simply access to care that's the issue, leading them, of course, to be diagnosed at a later age, not to undergo screening, because we know that screening makes a difference and is actually lowering the incidence of colon cancer in those over the age of 50.
Now, Mr. Boseman's cancer was at stage 3 when it was discovered. That's pretty far along, isn't it? I mean, can you briefly tell us about the different stages of colon cancer? And perhaps, are there warning signs once you get to stage 2 or 3?
Right. So that's a great question. So there's essentially 4 stages. One being the first stage, and that's typically the polyp has developed into a cancer. It's caught usually on a colonoscopy. Very often people don't have symptoms, and it's a surgical disease. The cancer is removed, and there is no further need for chemotherapy, because chemotherapy does not change the chances of the cancer coming back. But thankfully, at an early stage like stage 1, those chances are incredibly low. So those patients, the large majority, are cured with surgery alone. Stage 2 is a bit in the gray zone. The cancer is still only locally advanced. It has not spread outside of the actual colon, but it's a little bit deeper in the lining. And so for those patients, we really look under the microscope and we look at what we call risk factors. Does it look like, do those findings under the microscope give us a hint that perhaps some of these cancer cells learn to travel? And for those patients that are defined as high risk stage 2, we offer chemotherapy, and then chemotherapy does reduce the chances of cancer coming back. For stage 3, such as was the case with Chadwick, chemotherapy is offered to all patients with stage 3 disease, because what it means is that the cancer has learned to travel from the colon into the surrounding lymph nodes. It has not gone beyond that area, but what we know from data is that when it gets to those lymph nodes, there is a high chance that there are what we call micrometastatic cells, meaning these little cancer cells in the body, potentially in the bloodstream, somewhere outside of the surgical field that are not removed with surgery. So what we do is we give chemotherapy with the goal that chemotherapy eradicates these cells and that the patients are cured. And many patients are cured with chemotherapy following a surgery of stage 3 disease, but unfortunately not all. And those patients develop or present with initially with stage 4 disease. And stage 4 is the most advanced. It is when the cancer involves other organs, such as the liver or lungs. It can really involve, unfortunately, any part of the body, but those are the most common organs that are involved, as well as the abdominal cavity. And so for those patients, there is a chance of cure, but it is significantly lower. And we try our best with chemotherapy, with combination of chemotherapy and surgery, other interventions to control the disease, maintain the quality of life, have people live as long as possible. Again, obviously, always with the ultimate goal of cure, but unfortunately, we don't achieve that in the majority of patients. But that is where the active research is, we're trying our best.
And what about symptoms? Are there any warning signs?
So in terms of symptoms, early stage, as you asked, many patients do have changes in bowel habits. For young patients, particularly young onset colorectal patients, they tend to have more rectal tumors. So they tend to bleed. They present with rectal bleeding. Sometimes it's dismissed, and this is something that we want to get across. Don't dismiss symptoms. Abdominal pain, changes in bowel habits, bloating, any unexplained weight loss. Those are the things to really seek medical attention if it's something that is not just a few days, possibly from a bug or a gastroenteritis, and persists, then really we urge people to seek medical attention and get a workup and potentially get that colonoscopy that can be life-saving.
And finally, doctor, as the incidence of colon cancer ticks up and ticks younger, do you have any advice on how people can eat or lifestyle changes that they might implement to help stave it off?
I think, it's hard to say because, again, we don't feel that many of our patients actually have any of these risk factors clearly associated with it. But in general, for good health, for prevention, we do know that exercise and a healthy diet are key and are really important. And so that's what I would encourage people. And then again, importantly, if you have symptoms, don't dismiss them, seek medical attention, because this can happen even in people under the age of 50, as we're clearly seeing.
Very scary. All right. Well, Dr. Andrea Cercek, thank you so much for joining us and sharing with us all your insight into this terrible disease. Thank you so much.
Thank you for having me.